Welcome to our channel. Today, we're diving deep into a critical health topic, liver failure. Your liver plays a vital role in your overall well-being, from detoxifying your blood to aiding digestion. But what happens when this essential organ starts to fail? How can you recognize the early warning signs, and what steps can you take to protect your liver health? In this video, we'll explore the various symptoms of liver failure, explain why they occur, and provide insights into effective management and treatment options. Whether you're concerned about your own health or that of a loved one, understanding these signs can make a significant difference in seeking timely medical help. Stay tuned to learn how to maintain liver health and prevent severe complications. If you find this information valuable, don't forget to like, subscribe, and hit the notification bell for more health tips and medical insights. Let's get started. 1. Jaundice. Jaundice is a prominent sign of liver failure, characterized by a yellowing of the skin and the whites of the eyes. This condition arises from elevated levels of bilirubin in the blood. Bilirubin is a yellow pigment produced during the normal breakdown of red blood cells. Typically, the liver processes and excretes bilirubin through bile. However, when the liver is damaged, it cannot effectively remove bilirubin, leading to its buildup in the blood and tissues. The yellow discoloration is often first noticeable in the whites of the eyes and then spreads to the skin. Jaundice may also cause other symptoms such as dark urine, which occurs because excess bilirubin is excreted through the kidneys. Similarly, stools may appear pale or clay-colored because bilirubin is not reaching the intestines in sufficient amounts. Itching, known as pruritus, can also accompany jaundice, as bilirubin deposits in the skin irritate nerve endings. Jaundice is a serious indicator of liver dysfunction, and it requires prompt medical evaluation to determine the underlying cause and initiate appropriate treatment. If left untreated, the underlying liver condition causing jaundice can progress, leading to more severe complications and potentially fatal outcomes. 2. Ascites. Ascites is the abnormal accumulation of fluid in the abdominal cavity, often signaling severe liver damage. This condition occurs because of portal hypertension, a common consequence of liver cirrhosis. The liver's failure to produce sufficient proteins, particularly albumin, also contributes to fluid leakage into the abdominal cavity. Patients with ascites often notice a rapid increase in abdominal girth and experience discomfort or pain due to the pressure exerted by the fluid buildup. The increased pressure in the abdomen can push fluid into the lungs, causing difficulty breathing, known as hepatic hydrothorax. Patients may also experience a loss of appetite and early satiety because the fluid exerts pressure on the stomach, reducing its capacity to hold food. Ascites is often associated with edema, or swelling in the legs and ankles, due to the body's overall fluid imbalance. Treatment for ascites typically involves dietary sodium restriction and the use of diuretics to help reduce fluid accumulation. In more severe cases, procedures such as paracentesis, removal of fluid from the abdomen, may be necessary. If the underlying liver disease is not managed, ascites can recur and lead to further complications such as spontaneous bacterial peritonitis, a potentially life-threatening infection of the fluid in the abdomen. 3. Hepatic encephalopathy. Hepatic encephalopathy, HE, is a decline in brain function that occurs as a result of severe liver disease. The liver is responsible for filtering toxins from the blood, but when it fails, these toxins accumulate and affect the brain. Early symptoms of HE may include subtle changes in personality, memory problems, and difficulty concentrating. As the condition progresses, more severe symptoms can develop, such as confusion, disorientation, and a characteristic musty odor to the breath known as fetor hepaticus. Patients with advanced hepatic encephalopathy may experience motor disturbances, including tremors, difficulty with coordination, and a peculiar flapping tremor of the hands called asterixis. In severe cases, patients can lapse into a coma, which is a life-threatening medical emergency. The buildup of ammonia and other toxins in the brain can lead to swelling and increased intracranial pressure, further exacerbating neurological symptoms. Managing hepatic encephalopathy involves treating the underlying liver disease and reducing the levels of toxins in the blood. This can be achieved through medications that reduce the production of ammonia in the intestines and dietary modifications to limit protein intake. Lactulose, a synthetic sugar, is often used to treat HE by promoting the excretion of ammonia. Early detection and management are crucial to prevent permanent brain damage and improve the quality of life for patients with liver failure. 4. Bleeding and bruising. One of the critical functions of the liver is the production of clotting factors, proteins essential for blood coagulation. When the liver is failing, it cannot produce these clotting factors adequately, leading to a propensity for bleeding and easy bruising. Patients may notice that they bruise easily even with minor trauma, and cuts or injuries may bleed excessively and take longer to stop. Spontaneous bleeding can also occur in the gastrointestinal tract, leading to symptoms such as black, tarry stools, melena, or vomiting blood, hematemesis. Internal bleeding is a serious concern in liver failure. The impaired production of clotting factors, combined with portal hypertension, can cause varices, enlarged veins, in the esophagus and stomach to rupture, leading to life-threatening hemorrhage. Additionally, liver failure can affect the production of platelets, further compromising the blood's ability to clot and increasing the risk of bleeding. Management of bleeding and bruising in liver failure involves addressing the underlying liver disease and, in acute cases, administering blood products or clotting factors to control hemorrhage. Patients with significant liver dysfunction may require a liver transplant to restore normal clotting function and prevent recurrent bleeding episodes. Regular monitoring and proactive management are essential to mitigate the risks associated with bleeding and bruising in liver failure. 5. Fatigue. Fatigue is a common and debilitating symptom of liver failure. It results from the liver's inability to perform its vital functions, including metabolizing nutrients, detoxifying harmful substances, and producing essential proteins. When the liver fails, toxins build up in the body, and the overall metabolic processes slow down, leading to a persistent feeling of tiredness and lack of energy. The body's inability to effectively process and store nutrients means that energy levels remain low, regardless of diet or rest. Additionally, the psychological burden of chronic illness can contribute to feelings of exhaustion. Managing fatigue in liver failure involves addressing the underlying liver condition, optimizing nutrition, and implementing lifestyle modifications. Ensuring a balanced diet with adequate calories and nutrients can help support energy levels. Patients may also benefit from gentle physical activity tailored to their capabilities. Psychological support, including counseling and support groups, can help patients cope with the emotional aspects of chronic fatigue and liver disease. 6. Nausea and vomiting. Nausea and vomiting are frequent symptoms of liver failure, caused by the liver's impaired ability to filter toxins and waste products from the blood. When the liver is damaged, these substances accumulate and can irritate the gastrointestinal tract. Additionally, the liver's failure to produce bile, which aids in digestion, can further contribute to gastrointestinal discomfort and nausea. Patients may experience persistent nausea that interferes with their ability to eat and maintain proper nutrition. Vomiting can lead to dehydration and electrolyte imbalances, exacerbating the patient's overall condition. Chronic nausea and vomiting can also cause weight loss and malnutrition, further weakening the body and hindering recovery. Treatment for nausea and vomiting in liver failure involves managing the underlying liver disease and using medications to control symptoms. Antiemetic drugs can help reduce nausea and prevent vomiting. Ensuring adequate hydration and nutrition is crucial, and in severe cases, intravenous fluids and nutritional support may be necessary. 7. Spider angionas. Spider angionas are small, spider-like blood vessels that appear on the skin and are often a sign of liver failure. These lesions are characterized by a central red spot with radiating blood vessels, resembling a spider's web. They are caused by increased estrogen levels, a common occurrence in liver disease, as the damaged liver cannot effectively metabolize hormones. Spider angionas are most commonly found on the face, neck, upper chest, and arms. While they are usually painless and harmless, their presence can indicate underlying liver dysfunction and warrant further investigation. Spider angionas can be accompanied by other signs of liver disease, such as palmar erythema, redness of the palms, and caput medusae, enlarged veins around the navel. Treatment for spider angionas involves managing the underlying liver disease. In some cases, the lesions may fade or disappear with effective treatment of the liver condition. Regular monitoring and proactive management of liver health are crucial to prevent the progression of liver disease and associated symptoms. 8. Weight loss and muscle wasting. Weight loss and muscle wasting, also known as cachexia, are significant symptoms of advanced liver failure. As the liver loses its ability to metabolize nutrients properly and produce proteins, the body begins to break down muscle and fat stores to meet its energy needs. This process leads to a noticeable reduction in body weight and muscle mass. Patients with liver failure may experience a loss of appetite and difficulty absorbing nutrients, further contributing to weight loss. Muscle wasting is particularly concerning as it weakens the body, reduces physical strength, and impairs mobility. Management of weight loss and muscle wasting involves addressing the underlying liver disease and ensuring adequate nutritional support. In severe cases, enteral or parenteral nutrition, feeding through a tube or intravenously, may be necessary. Understanding the symptoms of liver failure is crucial for early detection and effective management. Recognizing these signs can help you seek timely medical intervention and potentially prevent severe complications. From jaundice and ascites to fatigue and cognitive impairment, each symptom offers valuable clues about your liver's health. Remember, maintaining a healthy lifestyle, regular checkups, and addressing any liver-related concerns promptly can significantly improve your quality of life. Thank you for watching, and we hope this video has provided you with essential insights into liver health. Don't forget to like, share, and subscribe for more informative content. Stay healthy and take care.